There's a blood test that costs $15. It is available at every commercial laboratory in the United States. It can predict your diabetes diagnosis a decade before it happens. Before your fasting glucose rises, before your A1C crosses the prediabetic threshold, before any symptom appears. Your doctor has never ordered it. Most doctors don't even know it exists as a screening tool. And the man who spent 25 years proving its predictive power, a pathologist named Joseph Kraft, who tested 14,000 patients at St. Joseph Hospital in Chicago, died in 2017 without mainstream medicine ever adopting his work. Today I'm going to show you his test, his data, and why measuring insulin, not glucose, is the key to catching diabetes before it destroys your body. I measure insulin levels on just about every patient that walks through my front door. Not glucose, insulin, because insulin tells me the truth that glucose hides. And the truth is this: by the time your fasting glucose or your A1C is abnormal, you are not developing diabetes, you have diabetes. The disease has been building for years, silently, invisibly, damaging your blood vessels, enlarging your liver, thickening your arterial walls, while your standard blood tests said everything was fine. Measuring glucose to detect early diabetes is like measuring the height of a flood to predict rain. The flood is the end result. The rain started hours ago. Insulin is the rain. Glucose is the flood. And we've been measuring the wrong thing. The simple version is the fasting insulin test. A single blood draw taken after an overnight fast, measuring the concentration of insulin in your blood. As we discussed in the previous video, optimal fasting insulin is below 5 to 7 micronits per milliliter. Above 10 indicates emerging resistance. Above 15 indicates established resistance. Above 20 indicates severe resistance and a pancreas approaching failure. This single number, combined with your fasting glucose, allows you to calculate HOMA-IR, the mathematical estimate of insulin resistance that catches the disease years before glucose-based tests. The fasting insulin test should be part of every annual physical. The fact that it is not, the fact that it must be specifically requested, is a failure of standard of care. But the fasting insulin test has a limitation. It captures one moment in time. It tells you what your baseline insulin level is, but it doesn't show how your body handles a glucose challenge. How much insulin your pancreas must produce to process a meal, how long that insulin stays elevated, and what the pattern of the response looks like. For this, you need the test that Joseph Kraft spent his career perfecting, the Kraft Insulin Response Test. The Kraft test is a 5-hour glucose tolerance test with serial insulin measurements. The protocol: you arrive fasting. A baseline blood sample measures fasting glucose and fasting insulin. You then drink 100 grams of glucose, a standard glucose challenge. Blood samples are drawn at 30 minutes, 1 hour, 2 hours, 3 hours, 4 hours, and 5 hours after the glucose load. Each sample measures both glucose and insulin. The result is not a single number, it is a curve. An insulin response curve that reveals with extraordinary precision how your body handles carbohydrates. Kraft analyzed 14,384 glucose-insulin response curves over 25 years and identified 5 distinct patterns, 5 categories of insulin response that range from normal to severely diabetic. These patterns were published in his book, Diabetes Epidemic and You, and in peer-reviewed literature. And they form one of the most comprehensive datasets on insulin behavior ever compiled. Pattern I, the normal response. Insulin rises promptly after the glucose load, peaks at 30 to 60 minutes at a moderate level, typically below 50 to 60 micronits per milliliter, and returns to baseline by 2 to 3 hours. This is the response of a healthy insulin-sensitive individual. The pancreas produces a controlled, proportionate insulin response, clears the glucose efficiently, and returns to rest. Approximately 20 to 25% of Kraft's patients showed this pattern. Pattern 2, the delayed response. Insulin rises after the glucose load but peaks later, at 1 to 2 hours instead of 30 to 60 minutes, and reaches higher levels than pattern I. The insulin remains elevated for longer, often not returning to baseline until 3 to 4 hours. This is early insulin resistance. The cells are not responding efficiently, so the pancreas must produce more insulin and sustain the production longer to clear the same glucose load. Fasting glucose in these patients is typically normal. A1C is typically normal. The standard blood tests would miss this entirely. But the Kraft curve reveals the compensatory hyperinsulinemia, the excessive insulin production that precedes diabetes by years. Pattern 3, the exaggerated response. Insulin rises dramatically, peaking at 100, 150, or even 200 microunits per milliliter, and remains elevated for 3 to 5 hours. The pancreas is producing massive quantities of insulin to overcome severe cellular resistance. These patients often have fasting insulin levels in the 15 to 30 range, but even those with fasting insulin in the borderline range show their true insulin resistance under the challenge of a glucose load. Their resting state looks manageable. Their stress state reveals the crisis. Fasting glucose may still be normal. A1C may still be normal. But the Kraft curve shows a pancreas that is screaming, producing insulin at unsustainable rates to maintain the illusion of metabolic health. Pattern IV, the delayed and exaggerated response. Similar to pattern 3 but with even more severe and prolonged hyperinsulinemia. Insulin remaining elevated at 4 and 5 hours post-glucose. These patients are in the final stages before overt diabetes. Their pancreas is producing extraordinary amounts of insulin, and even that is barely sufficient to control glucose. Some of these patients still have fasting glucose in the normal range. Their annual physicals come back clean. They have no idea what's building inside them. Pattern V, the diabetic response. Insulin production is low relative to the glucose load. The pancreas has burned out. Beta cells have been destroyed by years of overwork. Insulin is insufficient to clear glucose, and blood sugar rises dramatically and stays elevated. This is overt type 2 diabetes, the stage at which standard tests finally detect the disease. The tragedy is that patterns 2 through IV, representing years of escalating insulin resistance, were visible on the Kraft curve long before pattern V arrived. The disease could have been reversed during patterns 2 and 3. By pattern V, beta cell damage may be irreversible. Here is the finding that should have changed medicine. Kraft found that approximately 75 to 80% of his patients with normal fasting glucose. Patients whose doctors had told them they were healthy had abnormal insulin response patterns. Patterns 2 through IV. 80% of people with normal glucose were already insulin resistant. This disease was present, it was detectable, it was predictable, and it was being missed by every standard test their doctors ordered. Kraft's most provocative conclusion, published in his academic work and his book, was that the number of Americans with diabetes was vastly underestimated. He proposed that diabetes in situ, diabetes present in the body but not yet detectable by glucose testing, was far more prevalent than diagnosed diabetes. His data suggested that the majority of adults in developed countries have some degree of insulin dysfunction, and that the 37 million Americans officially diagnosed with diabetes represent only the tip of an iceberg that includes over 100 million more with undiagnosed insulin resistance of varying severity. If you cannot get a full 5-hour Kraft test, and most doctors are not set up to perform one, there are practical alternatives that approximate the information. The 2-hour insulin glucose challenge. Request a standard 2-hour oral glucose tolerance test with insulin measurements at fasting, 1-hour, and 2-hour marks. This abbreviated version captures the peak insulin response and the 2-hour clearance, providing most of the diagnostic information of the full Kraft test. Optimal 2-hour insulin should be below 30 microunits per milliliter. Above 50 indicates significant resistance. Above 80 indicates severe resistance. The triglyceride to HDL ratio. This is a free insulin resistance proxy that requires no additional testing, just your standard lipid panel results. Divide your triglycerides by your HDL cholesterol. In mg/dl units, a ratio below 1.0 is optimal, below 2.0 is acceptable, above 3.0 indicates insulin resistance, above 5.0 indicates severe insulin resistance. This ratio correlates strongly with measured insulin resistance because hyperinsulinemia drives triglyceride production in the liver while suppressing HDL. The lipid panel, which your doctor already orders, contains a hidden insulin resistance marker that is never calculated and never discussed. The waist to height ratio. Divide your waist circumference in inches by your height in inches. Below 0.5 is optimal. Above 0.5 indicates excess visceral fat, the fat that drives insulin resistance. This requires no blood test at all, just a tape measure. It is one of the strongest anthropometric predictors of metabolic disease, outperforming BMI by a significant margin. What should you do with this information? Step 1. Get your fasting insulin measured at your next blood draw. Request it explicitly. If your doctor questions why, say, "I want to calculate my HOMA-IR to assess insulin resistance." The data suggests it predicts diabetes 10 to 15 years before glucose-based markers. Step 2. Calculate your triglyceride to HDL ratio from your most recent lipid panel. You already have the numbers. Do the division. Step 3. Measure your waist to height ratio today. Step 4. If any of these markers are abnormal, request a 2-hour insulin glucose challenge to quantify the severity of your insulin resistance. Step 5. If insulin resistance is confirmed, begin the dietary and lifestyle interventions that reverse it, which we will detail throughout this series. Let me close with the injustice that this video is meant to correct. Joseph Kraft spent 25 years and 14,000 patients building the most comprehensive insulin response dataset in medical history. He proved with data that insulin testing predicts diabetes years before glucose testing. He published his findings, he wrote his book, and mainstream medicine largely ignored him. The standard of care did not change. Fasting's insulin is still not included in the annual physical. The Kraft test is not offered. The 88 million Americans with prediabetes, 84% of whom are undiagnosed, continue to walk out of their doctor's offices believing they are healthy, because their doctors measured glucose. And glucose is the last thing to change. The test that catches disease early exists. It costs $15. It works. It's been proven over 14,000 patients and 25 years. All you have to do is ask for it. In the next video, I'm going to tell you something your endocrinologist may have never said. Type 2 diabetes is reversible. Not manageable, not controllable, reversible. I've seen patients come off 3 medications. I've seen A1C values drop from 9 to 5.5, and not one of those reversals required a new drug. They required removing the cause. I'll show you exactly how. I'll see you there.